Anyways, I'm so honored to be here, Dr. Gersh, Dutch, all these labs and things that I use in practice. But the reason I'm here today was because I was sick. I was very sick. I was pre-med going into medical school, and I had 3 chronic disease conditions at the age of 21. I was overweight. I probably looked older than I look now. And I was going into my doctor's month after month. I was on 5 prescription meds. And I actually thought that was good because I was going to be a doctor. And here I was going to doctors and I was on medications. I actually thought that was the right thing to do because growing up in Iran, we were poor. And so my parents thought if they took me to get shots and to go visit the doctor and get meds, they were doing the right thing. That was healthy. Well, little did I know that a boyfriend at that time was looking at me and going, you know, you're really not healthy. You're getting all these migraines, and why don't you go see a naturopathic doctor? And I said, a natural what? And that's what changed my life. So the reason I want to talk to you guys about my story is because she helped me get to know myself. And the reason why she did that was nothing fancy. She just spent time with me. She spent almost 2 hours on an initial visit and asked the questions my kids ask. Just basic questions. Why? 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 Everything I would say, she would say, oh, I wonder why you do that. I wonder why you do that. I wonder why you want to become a doctor. And I said, because I'm caring. I care for people. And she said, okay, why is that? But basically it got down to me realizing my core beliefs. And one of them was that I felt I wasn't good enough. And the underlying causes often for being the Persians here, we either are doctors or engineers. So I kind of had no choice. I had to pick one or the other to please my father. Fast forward 20 years, I have a patient who comes in. She's 45, female, very big person here in Orange County. I obviously can't say her name, but she is a CEO of a huge company, does really well for herself. She comes in, she's been to many integrated doctors here, and my director says that, you know, this person's really important. And, you know, no pressure, I'm so nervous. I have my residents that day who are going to see this person, and so the residents get to see her, and I'm the attending, and, you know, we've done it. This person has done every lab you can think of. She's been on Xanax for 20 years, now on Klonopin, high dose, which are benzodiazepines, which are pretty hard to get off of if you've been on them for a long time, especially at the dose that she was on. She has been to therapy for 7 years. She was overweight, and that's the reason why she actually came in. Her chief concern was weight. And the last thing on her list was anxiety. And so, you know, as functional medicine or naturopathic doctors do, we get the story. They present to me the case with her story. This is how she was born, she was breastfed, this is what she ate, she had a lot of sugar, these are the traumas in her life. They tell me the story. And often what we do is we go beyond the story. Okay, so who is this person with this diagnosis, with this story? The story is not enough. That ICD code often does more harm than good. And as a physician myself, I've probably done more harm than good by labeling people with this thing. And what I had to do after a lot of visits that I saw she was not getting better, she was already tried every anti-anxiety, herb, L-theanine, every genetic test, I mean, you name it. And for an anxious person to get more testing and be told that this is another thing you need to address is not a good thing. We're actually doing more harm. So I got to, I said, you know, enough, guys, come on in. Let's go in with her and let's book 2 hours with this patient. What is that? Time. Time is precious. That's why I'm so grateful to do what I do, is because I have time. I cannot imagine what kind of a doctor I would be if I didn't have that much time. I got to know her, and I said, okay, so you have this label, and I knew right away from all the therapy she's had done, she was giving me all the answers that people give because they know what the right thing is to say. So I knew it's kind of like a nut. You have to crack. You have to crack to get inside the seed. And I said, okay, you're going to be challenging because there's a lot of resistance I'm feeling from you. You're very attached to this diagnosis. You're so attached to panic disorders. She's had a lot of panic disorders and anxiety that I need to go underneath that. And I said, what are you so anxious about? Let's pretend we're 6. I have a 6-year-old, so it helps. Let's pretend we're 6 and I don't know that word. I don't know, I'm not a doctor. How would you describe what you feel? And she said, I get scared. And I said, scared of what? And she said, that I'm gonna die. And I said, okay, so you're scared of death? And she said, well, yeah, I guess. And I said, okay, I'm thinking in my head, you've got all this therapy, you must know more of what this is about. And she said, yeah, I'm scared of dying. The smallest little thing makes me feel like I'm gonna die. And I said, okay. And so I go, what is it about death that scares you? So what? So you're gonna die. And I literally became a 6-year-old, and I just was so intrigued to understand her. And I was not attached to treating her. I wasn't attached to getting rid of the anxiety. I actually wasn't attached to anything. I just wanted to know, how is your fear of death different than my father's fear of death? And I know we don't have a lot of time, but basically we got to this. She said, I just feel like I'm gonna run out of time. I feel like, you know, I have 3 kids, I run this big business, my husband's also famous and has his own business, and we don't get to spend a lot of time together. And I said, okay, so what is it about death again that you're afraid of? Do you think you're gonna get cancer? Like, this is what I'm thinking. And no, it really wasn't a fear of death. What do you guys think she was really afraid of? Exactly, so not having enough time is what? And so I said to her, I don't know, are you afraid of death or are you afraid of not living? And I know this sounds really simple, especially coming from a physician, but it really was that simple. This was 3 years ago, and she has not had one panic attack. And now we have history of anxiety on her ICD codes. She's off Klonopin, which was not easy to do, but she is. And the moral of the story is that helping people get to know themselves, the core, the underneath layers, with time, is what's missing right now in medicine. And if I had had health coaches at that time, I wouldn't have had to keep checking in and reminding her and helping her live her purpose. She's no longer, she sold the business, and she's a salsa instructor because her passion was to dance. But again, none of this would have happened if I wasn't fortunate enough to collect insurance, which is very rare for what we do. And this needs to be available for everyone, not for patients who have money, not for patients who have insurance, but for every single person. We need to have time. And I'm so thankful for James for coming up with this brilliant idea, and thank you.